And hello there, it's noon and it is Friday, and that means it is time for our regular Lunch and Learn. Now, I'm just going to tell you that I'm going to be trying to pronounce some of these words, and these words are kind of crazy in this report, so kind of bear with me if I stumble a little bit. I'm going to try not to, but these are some big chemical words, so I may break it down a little bit so that I'm not stumbling over what I'm trying to say. My mom used to say when she would stumble over her words that her tongue wrapped around her eye teeth and she couldn't see what she was supposed to say. So that's always been something that I have tried to practice, and I practice these words, but we'll see what happens. So today what we're talking about is cruciferous vegetables, okay, and the chemical compounds that they emit that are really beneficial to our health. Now, here at Abundant Health and Wellness, which is a holistic healthcare clinic in downtown Humble on the corner of Main Street and Avenue C, we have people come in all the time, and a lot of people want to just work on their health with their food choices. And so I saw this article. Now, this is an article that appeared last week in the Epic Times. And if you guys don't get the Epic Times, you're really missing a lot of good news writing. So this is specifically a news article that we're going to be talking about. And the chemical that we're going to be talking about is called sulforaphane. Okay, just understand it is a sulfur compound. I can say sulfur easily, okay? So we know, if we've done any kind of research on foods, we know that the cruciferous vegetables have a lot of good compounds, and we know that they have a lot of sulfur in it. Now, why do we know that? Well, because if you have digestive issues and you try and eat these foods, guess what? You're going to have a lot of gas and bloating because you don't have the right enzymes to break it down. But here at the clinic, we've got those enzymes. We can help you with that. Now, the cruciferous vegetables that we're looking at are broccoli, cauliflower, Brussels sprouts, and all of your cabbages. All right, so I'm going to tell you there are about 10 different health issues that these foods will help you with, and so it's really important. So it's Brussels sprouts, cabbage, cauliflower, kale, radishes, rutabaga, turnips, and even arugula. So that's a little bit of a larger menu than what I said before. Okay, so all of these vegetables make this chemical called sulforaphane. Okay, it is a phytochemical that is in abundance in these vegetables, and it is getting a lot of research on how this food choice, and usually when they've been doing these tests, they've been using broccoli sprout extract. So a broccoli sprout extract, a sprout is more of the plant before it actually becomes the broccoli that we normally are used to eating. So it's a little bit more tender. I think the taste would be a little bit more tender too, because broccoli can be pretty stout. I know sometimes we get broccoli and we'll put it in the fridge, and you open that fridge and wow, you know, that sulfur compound just comes out and hits you in the face, and it's one of those things like, yeah, well, this is just a really strong bit of broccoli here. But when you see what all it will do for you, you could be really excited about this. So number one, it has anti-cancer benefits. Okay, so this reputation is linked mainly to, I'm gonna say this big word again, sulforaphane's potent antioxidant and anti-inflammatory property. It is not dissimilar to turmeric or curcumin. Okay, one promising study found that the combination of sulforaphane, aspirin, and curcumin was effective, okay, chemo prevention for pancreatic cancer. Now, we all know that pancreatic cancer is one of the most deadliest cancers. It's also one of the most fast moving cancers. And so this is a preclinical study that said if you ate these vegetables and you added curcumin and an aspirin to your regimen, now I don't know exactly what the recipe is here, so don't go and try and do this by yourself. But if you take curcumin and you take a lot of broccoli, you can actually be preventing pancreatic cancer, which is awesome because we need to be able to prevent that. It is a very fast moving cancer. And the report says it doesn't stop there. Sulforaphane has been studied for the prevention and treatment of several different types of cancer, including stomach, bladder, breast, prostate, lung, colon, and skin. So mom is right when she says it's really healthy for you to eat your vegetables. So hopefully, if you're not eating these vegetables, you're going to eat them a few times a week at any case to help you prevent the onset of cancer. It says specifically that these foods possess the capacity to intervene in multi-stage carcinogenesis through the modulation and or regulation of important cellular mechanisms. It's said to be selectively toxic to malignant cells. Let me break this down for you. When you are adding these foods to your body knows where to send them. They go into the cancerous cells and they disrupt their communication, and it is specifically toxic to cancer cells. So for all of you that may not be paying attention when I tell you these things, all of us are dealing with cancer all the time. And that is because we do not live in the Garden of Eden, and we live in a very, very broken down physical atmosphere. We live in a place where the food is not as nutritionally dense as it used to be. And so our bodies are just more liable to aging and that kind of thing. So if you are able to eat these foods, then these foods are going to go in and they're going to disrupt the cancer mechanism that is going on in all of our bodies, and it makes sure that those cells are not progressing, and it's only selectively toxic to cancer cells. So this is something to think about. If you are somebody that you eat cabbage or broccoli or cauliflower or whatever, and you have a lot of gas and bloating afterwards, this could be those foods dealing with those malignant cells. And those malignant cells have byproducts, which are not nice. A lot of people think that cancer is a fungus, and we know what fungus does, right? You add yeast to hops and whatever that you make beer from. I'm not a brewer, so I don't really know, but I do know that you add the yeast to the sugars and you ferment them and you get bubbles. And so if these vegetables are going into the body and disrupting cancer at the cellular level, you could have bubbles. And so that might be a different way of looking at it. I always want to have enzymes too, because if you don't have the right enzyme mix, then you're not going to be able to metabolize these vegetables. All right. It says potent doses of broccoli sprout extract activate a detoxification gene that may help prevent cancer recurrence in survivors of head and neck cancer. So this is really, really important. Cruciferous vegetables contain extracts that are effective at inhibiting lung cancer. All right. It says it is good at inhibiting the epithelial tissue in skin cancer and colon polyps. So if you are someone who has this in your family, or if you are a cancer survivor, you really need to pay attention to this and add more of these vegetables into your diet. Possibly even you could juice them and get that benefit cells, but it's capital N, capital C, M, 460 cells. Okay, so there was a 57.33% in these cancer cells in colon damage when the broccoli was introduced. That's a lot. That's almost a 60% reduction. So this is really, really important information. With selenium treatment, enhanced protection against free radical mediated cell death provided by any kind of co-treatment. So co-treatment would be radiation or chemotherapy. So this is something that you could also use in conjunction with traditional cancer treatments if you choose to go that way. You know, that's not kind of the way we like to go, but if that's your preferred way to go, then you can actually add a lot of broccoli extract, and what that's going to do is going to help your chemo and your radiation do an even better job. So that's something that's really, really important. So number one on the list is that these vegetables are cancer preventative. They also offer depression relief. Now, if I could tell you the people that come in here and tell me they're depressed, and it really just makes me want to cry, because I have been depressed in the past. It's been a long, long time since I've been depressed, but it's not a happy feeling. And so these vegetables work on the brain and nervous system to help with depression. So it says in a 2010 study, right? That's 2016 study, found that broccoli sprouts were effective to prevent or minimize a relapse by inflammation into depressive states. Okay, inflammation causes depression. The same study found that extracts of broccoli sprouts were so effective, they acted as a prophylactic that could prevent the onset of LPS-induced depression. So LPS-produced depression is a lipopolysaccharide. So this is a chemical that you make with your food. So basically what it's saying is that if you eat your cruciferous vegetables, they are preventative from this type of depression. This is a chemical depression set up by metabolizing or not metabolizing your foods properly, and the broccoli will help with that, which is awesome. Okay. It says that the lipopolysaccharide is a bacterial-derived inflammatory factor known to cause wide range of health issues, depression being one of them. So your broccoli sprouts are going to help with that as well. Pain relief. Now, I never reach for a bag of broccoli when I'm in pain, but maybe I might do that in the coming weeks if I should have some pain. It says there is evidence that the sulforaphane chemicals have significant value in pain or pain management. A 2000 study, the year 2000 study of female fibromyalgia patients. Now, if you don't know what fibromyalgia is, that is a nervous disorder that causes a lot of muscle pain, a lot of nerve pain, and we know a lot of people that have this. So this is primarily a disease that affects females. But in this 2000 study, right, it showed that fibromyalgia patients reported that a combination, I'm going to say these big words again, or I'll just break it down, of vitamin C and broccoli powder, reduced pain sensitivity and improved quality of life. So where do you get broccoli powder? Well, you get broccoli powder here. We've got a product here called Vital Life, what is it called? Vital LF, I think is what it's called. And it's got your spinach, it's got your broccoli, it's got all kinds of super greens and super fruits in there. So if you don't want to take the time to juice your vegetables, or you don't really like the way these vegetables taste, you can get it in a really good tasting powder that you mix with water. You can mix with apple juice if you prefer it that way. I just do it with water, and really it tastes good. It's not grainy, it's not silty. It's really, really good, and you'll get all of your servings of your greens in there, and I'm pretty sure it's got broccoli juice in there as well. All right, in a 2016 publication, it said that the potential for sulforaphane via the broccoli sprouts noted significant, and there's another big word, pain-blocking results, okay, that bode well for further study into the pain-relieving benefits. Okay, number 4, broccoli and all of those vegetables help prevent cardiovascular events. Now, just so you know, women of a certain age, if you are postmenopausal, 95% of cardiovascular events happen post-menopause, and that's because you don't have any estrogen running around in your body. So it's really, really good for you to supplement with bioavailable estrogen, as just for the fact to prevent the cardiovascular event. I still want you to eat your broccoli, but women, you need to have your estrogen as well. And we have a very good source for that. In fact, we've got several sources now. So call us if you need that support. So it says that the sulforaphanes show that it helps with inflammation of the arterial walls. It inhibits obesity. It relieves hypertension and other conditions that are part of cardiovascular events. With the regard to hypertension, a 2012 study reported that sulforaphane decreases renal and vascular oxidative stress and inflammation, as well as blood pressure. So this is something that you need to know, because if you have high blood pressure and you're on blood pressure medication, you really have to watch your kidney function, because high blood pressure diminishes your kidney function. And if your kidneys don't work, then you're going to have dialysis and that kind of thing. And we don't want to go there. So this was studied using, I think they used broccoli sprouts again, and it showed that it reduced the oxidative stress in the heart and in the kidneys. Now, you're going to ask me, what is oxidative stress? Well, think about rust. If you have a nail, and the nail is nice and shiny and silvery, whatever it's made out of, it looks like silver, and then you leave it out in the elements over time, and it develops this rust, right? And the rust breaks it down. It makes it weaker. It won't work like it's supposed to work. We know that we have rusty hinges or that kind of thing. So oxidative stress is your insides rusting, right? So this broccoli, or this sulforaphane, which is in all of these foods, helps reduce the rusting from the inside out. And don't you know that's just what aging is? Aging is just oxidation of your inside. So if we can do something to stop that, wouldn't that just be a blessing? You know, I have people come and they, if you were here with me, you would be looking at my face exactly like you're looking at my face right now. And I would be sitting across the table from you, and I would be talking to you. And if you said, well, I've got XYZ, but of course I am 60 whatever or 70 whatever, I'm going to tell you I don't believe in age-related diseases. Yes, I know they happen. But I'm a firm believer that with the right kind of diet and the right kind of supplementation, that you don't have to be a victim to that. So I'm just going to throw that out there. So we don't want to be rusting from the inside out. So the fifth benefit that these vegetables have is on antioxidant ability. There are over 300 studies in PubMed alone. If you guys do any kind of Google research, they will send you to PubMed, and that's a very reliable source. You can always look at PubMed. I quote PubMed all the time. It's a very scholarly website, so you've got to have your medical dictionary right by you so you can understand those big words, but it's really, really, really good. So 300 studies looking at these vegetables as antioxidants. So it says one particularly interesting study was carried out on young male smokers. Now, I know you guys smoke, you shouldn't be smoking, but this is young male smokers, in which 250 grams per day of broccoli was consumed. Now, who knows? Raise your hand, 250 grams of broccoli. Well, that's about a cup and a half, all right? Because I didn't know, I had to look it up. About a cup and a half of broccoli. So they consumed this broccoli every day for a 10-day period. At the end of the treatment, the researchers observed a decrease in the circulating CRP, so C-reactive protein. C-reactive protein is on your blood work, and it shows how much inflammatory responses are going on in your body. So if you have a high CRP, then you have high inflammation, and we know that inflammation always leads to chronic disease, and so we do not want that. So we know that smoking is inflammatory. Why is that? Well, because cigarettes and cigars and snuff and all that kind of stuff have in it cadmium. Cadmium is a heavy metal, so you can get heavy metal poisoning, and it kills your lungs if you're smoking. So what they're finding is broccoli sprouts, particularly a cup and a half a day for 10 days, reduces the C-reactive protein. So if the C-reactive protein is reduced, that means that the toxic chemicals are being flushed out of the body because they're not setting up that inflammation. That's what inflammation is. Inflammation is your immune system finding something in the body that's not supposed to be there and then setting up a defense against it. So inflammation is a good thing because it rallies your immune system. But if it goes on forever, then you have chronic inflammation and that breaks down everything. So we want inflammation because we want our body to work, but then we want to snuff out that inflammation with the right remedy so that we're not setting us up for a disease process. So I hope that that was really clear to you. It says, number 6, it is protection from, and it helps with the elimination of toxins. So we did a little bit of that with the inflammatory response with the antioxidants. So here, the paper says there are so many toxic substances present in our lives. Well, yes, our food is not clean, our environments are not clean, we've got dyes, we've got preservatives, we've got antibiotics, we've got hormones, we've got all these things in the things that we use on an everyday basis. And so our lives are very toxic. It says, fortunately, cruciferous veggies and their sulforaphane-rich tissues can help, as noted in several studies. In 2014, a randomized clinical trial recruited 291 participants from a rural area in China, an area known for high levels of air pollution. The non-placebo group, consumed a broccoli sprout-derived beverage, providing a daily dose of 60 microjoules of, I'm going to say this big word here, glucocorphine, and about 40 microjoules of sulforaphane over a 12-week period. Essentially, they were given a concentrated extract of cruciferous vegetables for 3 months. Urine testing found rapid and sustained, statistically significant increase in the elimination of toxic substances and those drinking the beverage over the placebo group. So let me just break this down for you. When we have a lot of toxic material, especially heavy metals in the body, and we get that from our vaccinations, we get it from our silver fillings that we have, we get it from if we're of a certain age and we had lead pipes in the house, or we have an old house and we have lead pipes. We had lead paint when I was a little girl. So you just accumulate all this kind of stuff. My husband was in the Navy and he used to paint the bottom of the ships with red lead paint. So there's any number of ways that you can get exposed to this, but the body flushes out heavy metals through the kidneys. And so this particular study shows that these people that drank this broccoli extract drink over a period of 3 months, their urine had high concentrations of this toxic material. And it said it was significantly high. So it wasn't just a little bit high, it was significantly higher than normal. So that's a good thing. We all are subject to toxic materials every day of our life, no matter where we are. Here in the United States, of course, we have the EPA and that kind of thing. But if you live in the Houston area, just in the last 60 days, we've had several fires over in our chemical plants. And you know that stuff gets in the air and you know it gets to you. And so you want to be able to eat your cruciferous vegetables so that you're able to process those toxins, you know? So that's a good thing. All right, so 7. Type 2 diabetes and insulin resistance support. So you're going to know if you have type 2 diabetes because your A1C is going to be high. You may not know if you have insulin resistance. Now, insulin is a hormone that the pancreas produces to help you use the sugar in your diet to provide food for your cells. Now, if there's a breakdown in this mechanism, you are what they call insulin resistant. And if you're insulin resistant, then you're usually heavy because you can't process those sugars. So Broccoli helps with insulin resistance support. It says that sulforaphane and the consuming of cruciferous vegetables have shown specific positive results in diabetes and insulin resistance, in particular with insulin resistance as an aspect of type 2 diabetes can cause havoc in the body. A 2016 study investigated the effects of broccoli sprout powder, I turn my paper over, containing a high concentration of sulforaphane on insulin-resistant and type 2 diabetic patients. In a randomized trial, 81 patients received either a high concentration of sulforaphane powder or a placebo over 4 weeks. The end results showed that the sulforaphane lowered the levels of insulin resistance. Other studies have demonstrated similar results, showing decreased oxidative stress and insulin resistance, and that the sulforaphane could prevent the nephropathy, diabetes-induced fibrosis, and vascular complications. So this is really, really important. If you have insulin resistance, you're going to be more likely to be diagnosed as a diabetic. So if you can stop it before you get there, that's awesome. If you already are a diabetic, you know you're going to have kidney damage. You know you're going to have vascular issues. And if you take these vegetables, you're going to reduce the significant problem with that because of these magical properties that these particular vegetables have. Number 8 is Helicobacter pylori. Now, we shorten that to H. pylori. H. pylori is a corkscrew bacteria that gets right in your belly, okay? So, hopefully you can Google your digestive system. Food goes down the tummy, goes under the heart, into the stomach. On the right side of your body, it goes down into the small intestine. That's called the pyloric sphincter. At that place is where the H. pylori bacteria loves to live. And it's a corkscrew bacteria, and it burrows its way through the GI lining, all that mucus that we have. It buries itself in there, so it is resistant to antibiotics and that kind of thing. So it is primarily the bacteria that is, it results in ulcers, and it also results in stomach cancer. So this sulforaphane is a great support to the Helicobacter pylori. It said it is the most seriously associated bacteria with stomach ulcers and gastric cancers. The sulforaphane laden, I can't read, here you go. The sulforaphane-laden cruciferous friends help eliminate the colonization of this organism in our bodies. So broccoli and kale and all of these vegetables can do what antibiotics have a really, really hard time doing. So if you have stomach cancer, you really need to eat these vegetables. And I'm just hearing you say, but they give me gas and I don't feel well. They're giving you gas because they're working on the problem area. Now, I didn't have time to bring supplements in here to help you today, but we do have digestive enzymes that are going to help you digest your food so you're not going to have the gas and bloating. We also have in a powder form or a capsule form. We do have these products. Now, if you take it in the capsule form, you're going to have to take a lot of capsules in order to get everything in it. And I know the formulator personally, and he says he can't put everything in the capsules that he can put in the powder because the capsules would just be too big. I take the powder. I take it at least once a week, and it's very, very tasty. And I'm not going to lie, I have trouble with taste sometimes. And if it doesn't taste good, depending on how much I have to have, I may or may not do it, but this actually tastes good. And so I really want to encourage you. It's called Vital LF. So I want to encourage you to come by the clinic and get that if you have any of these issues. Number 9 on the list, and all of us old girls are going to be happy about that. Anybody over 50 D, because Alzheimer's is attacking people younger and younger, and I think it's because of all the vaccines we're getting these days, the flu vaccine and the shingles vaccine and the pneumonia vaccine. I think that it is introducing more heavy metals into the brain, which is the one of the contributing factors of the Alzheimer's. So studies suggest that sulforaphane might be a promising therapeutic agent for cognitive enhancement. Now, that means your brain's going to work so much better. Now, I'm all about cognitive enhancement. I love a smart brain. I do not want my brain to deteriorate and all that kind of thing. So this is one of the reasons why I'm glad I take that Vital LF every week, because it helps me. And we have cruciferous vegetables probably 3 or 4 times a week. We do broccoli, we do cauliflower, we do Brussels sprouts, and we do cabbage as well. So we get a lot of it in our diet, but we also get it in our supplements as well. So it will help with Alzheimer's, increasing cognitive decline. So even if you don't have Alzheimer's, but if you just have older people in your life that are getting a little demented, try and give them more broccoli, more cauliflower, and that kind of thing, and let's see what happens with that. And then number 10, dysfunctional inflammation is increasingly seen as a root cause in the development of chronic illness and disease. And we've said that a little bit, we've alluded to that. In some form or another, the body that is unwell is inflamed. Now, we say it another way. We say it, if you're inflamed, then you're unwell, okay? If your cholesterol, I'm just going to walk over into the dark side. If your cholesterol is high, right, your LDL is high, it is because you have a lot of inflammatory processes going on. Why is that? Because LDL cholesterol is the Band-Aid that the body makes to stop the inflammation, or to handle the inflammation. When you come and see me and we get the inflammation resolved, your cholesterol numbers go down perfect range. And so this sulforaphane helps with that. In a recent cell-based study published in 2016, so this is pretty recent, there is clear evidence that pre-treatment with sulforaphane completely restored the antioxidant status and prevented inflammatory responses. Okay, this is huge. It says, they went on to say that the protection offered by sulforaphane against acrolein-induced damage is attributed to the antioxidant, anti-inflammatory potential. More and more data suggests that sulforaphane may be useful as a therapeutic agent in the treatment of inflammatory conditions and diseases. So I'm really looking for the day when our medical doctors say, you know, you've got this inflammatory process, go home and eat some broccoli and some kale and some Brussels sprouts and call me in 2 weeks and we'll see how you're doing. So I think it was Hippocrates said, let your food be your medicine and your medicine be your food. And we definitely agree with that. I hope you have enjoyed this article, because I was really excited. We like broccoli. We like all those vegetables. Not every day, but, you know, we kind of mix it up and that kind of thing. And so we're really doing some good things for our health. Now, next week is 4th of July, and we are actually going to be closed Thursday and Friday, so I will not be doing Facebook Live next week. I am going on a little mini vacay, and so I won't see you next week, but I will see you the following week. So you guys take care of yourself, enjoy your freedom, and have a great, great, safe celebration. Love you much, and I'll talk to you in 2 weeks. Bye-bye.